Well, good morning, everybody, and welcome. Thank you very much for joining us this morning. My name is Jen McEwen. I'm the state senator representing most of the city of Duluth on beautiful Lake Superior. And it is my great honor and privilege to be here this morning with my colleagues, Representative Liz Ryer, Representative Liz Bolden, Senator Omar Fateh, and Senator John Marty, to announce the formation of the Minnesota Health Plan Caucus in the Minnesota legislature. If you'll notice, we have 4 new legislators in our first term, and also one of our mentors, Senator John Marty. I know that for me, and I can't speak for all of my colleagues, but I think that there is a common thread amongst us, that when we were running for office, when we decided to run for office, and we were running our campaigns, we heard a lot from our constituents about wanting to see a comprehensive, universal coverage healthcare plan for Minnesota. I know that I heard that in Duluth from many people across the spectrum of the healthcare industry, business, leadership, local leadership in our municipalities, and patients who had had heartbreaking experiences with the health insurance industry and knew that we needed some change. So they're asking for some transformative change within our healthcare system here in Minnesota. So that issue, amongst others, but that issue in particular was something that really drove me in my run for the Minnesota State Senate, and that my constituents are very hopeful that is coming up in our future for Minnesota. So the work that we're doing, and the reason why we decided to form this caucus, is because there has been a tremendous amount of grassroots organizing done by citizen groups, by advocacy groups in the state of Minnesota to build up education and awareness about the Minnesota Health Plan, authored by Senator John Marty. And again, this is a broad coalition of health justice allies, Healthcare for All Minnesota, groups of healthcare providers, labor, business, municipalities, farmers. It is a broad coalition, and after our press conference today, we're going to go out to the Capitol steps, and people will be able to hear from this coalition of allies who are all coming together and have done so much work around organizing for the Minnesota Health Plan. So the purpose of what we're trying to do here in the legislature is to create a structure within the Capitol to give voice and to elevate the work that has already been active and happening with those allies at the grassroots level. We've seen for a number of years since Senator Marty introduced his plan, and I will note that Senator Marty wrote a book about his bill and making the case for why we need a comprehensive health care plan in Minnesota that will have, again, comprehensive coverage in terms of care. It will cover things like eye care, hearing, dental, mental health care. It's comprehensive in that way. And it also covers everybody. So people's health care is not tied to their employment. They just get health care as a right by virtue of being a Minnesotan. And so if you haven't checked out this book by Senator John Marty, please do. He has a website that has a wealth of information answering people's questions about this plan, cost, coverage, all sorts of the normal questions that people would have about what this would look like for Minnesota. And that's at mnhealthplan.org. People can check out that website. Just real quick before I pass the microphone off to my colleagues, I wanted to note just how important it is for those of us who live outside of the metro in Minnesota to be pursuing this plan in particular. In northeastern Minnesota and in other parts of rural Minnesota, we've seen a consolidation within the healthcare industry. And this is the natural result of having a profit-driven healthcare system, where now we have a situation, for example, for people who live in Grand Marais, Minnesota, up on the shore, North Shore, up close to Canada. People who live up there who are having a child have to make a 2.5-hour drive on a 2-lane highway 61 along Lake Superior to get down to Duluth to deliver a baby. That's unacceptable. It shouldn't be like that. There's no reason why we should have those shortages. So this type of health plan would allow us to have more control and to make sure and to ensure that we have adequate services throughout the state of Minnesota so people don't have to, for example, drive 2.5 hours when they need to deliver a baby. And that reason, as well as the financial reasons for passing something like this, are what led my city of Duluth, just very recently at the end of last year, to pass a unanimous resolution in the city council asking our legislative delegation to move forward with the Minnesota Health Plan. And in that resolution, and again, it was passed unanimously by the Duluth City Council, which I think speaks to the growing recognition across party, across political ideology, across that spectrum of just the myriad of reasons why we need to adopt a universal health plan like the Minnesota Health Plan. So the Duluth City Council spoke to how the Minnesota Department of Health just last year noted that at the current rate of growth of Minnesota's total healthcare spending is forecast to double in the next 10 years, to be 19% of our state economic spending, more than housing, more than transportation. And additionally, the Duluth City Council noted the growing cost of the healthcare for our municipality, and that we are at a breaking point. So that really is the takeaway, that we are at a breaking point in our healthcare system. This is being recognized across interest groups, across municipalities, and there's a growing recognition of the need for a plan like the Minnesota Healthcare Plan.